Hi, my name is Misty Cundiff. I'm a nurse practitioner in rural Kentucky, and let's take a tour of the colon. The colon is the large intestine. The rectum is the tissue that connects the colon to the anus and holds waste there until it's ready to be emptied. Cancer that starts in the colon is called colorectal cancer, and it's responsible for 2,500 cancers in the state. It's actually the second leading cause of cancer deaths in America. About 800 people die from colon cancer in Kentucky each year. Colon cancer usually begins as a small growth known as a polyp in the colon, and this develops into cancer over time. Many people with colon cancer or polyps don't develop symptoms for a long time. Those people who do develop symptoms may experience some bloating, abdominal pain, some cramping that doesn't go away, a feeling that your bowel is not emptying completely, changes in bowel habits or consistency of your stool, feelings of being very tired or weak, unexplained weight loss, or blood in the stool. The risk of colon cancer increases with age. Colon cancer is most common in adults age 45 and above, and those with a personal family history of colon cancer or inflammatory bowel disease such as Crohn's disease or ulcerative colitis. There are several risk factors that can increase your chance of colon cancer.
But there are some risk factors that you can control. Those would be things like lack of regular physical activity, diet low in fruit and vegetables, low fiber and high fat diet, being overweight or obese, alcohol consumption, and even tobacco use. So a genetic condition that can increase your risk for colon cancer is what we call Lynch Syndrome. It's hereditary and it's caused by an inherited genetic change that can be passed from parents to children. So if your parents had Lynch Syndrome, then you should be tested as well. If you do have Lynch Syndrome, your doctor may recommend you getting screened earlier than age 45. About 3% or 1 in 30 of colon cancer cases are actually due to Lynch Syndrome. Who should be screened and how? Colon cancer screening should begin at age 45 and continue until you're 75 years old for people who are average risk. There are two main types of testing: stool-based tests, which includes FIT testing and DNA tests, and also visual-based tests such as colonoscopies. Stool-based tests are tests that you actually do at home, and they check for blood in your stool. You take a sample of your stool and then you will send it in to a lab for testing. And a FIT test should actually be done every year. A DNA test is performed every 3 years. You may need follow-up tests depending on your results. If it is a positive result, that doesn't mean that you have cancer. That just means that there's need for further testing. Visual tests are performed by an actual medical professional, and that would be a colonoscopy. A colonoscopy is a screening test to look inside the rectum and the colon. So during a colonoscopy, a doctor will be checking for polyps, and those could be precancerous. The goal of the colonoscopy is to find those polyps and take them out before they can turn into cancer. A colonoscopy should be done every 10 years for average risk individuals, but can be performed more often if polyps are found. Both types of tests are reliable at detecting colon cancer if performed at recommended ages and intervals. Please talk to your healthcare provider about which test is right for you.